Hello everyone, welcome back to the channel. If you're preparing for your nursing or medical exams, you're in the right place. Today, we'll be tackling some of the most challenging and high-yield MCQs on neoplastic conditions of the genitourinary system, complete with answers, rationales, and test-taking strategies to help you score full marks. Make sure you watch closely, take notes, and test yourself as we go along. These are not just basic recall questions. They're designed to sharpen your critical thinking and exam readiness. So, let's dive right in. Question 1. Testicular cancer most commonly affects which age group? A. Boys under 10 years. B. Men 15 to 35 years. C. Men 45 to 65 years. D. Elderly over 70 years. Answer: B. Men 15 to 35 years. Rationale: testicular germ cell tumors peak in young adult men, unlike most other GU cancers that affect older men. Strategy: young man plus testicular mass equals testicular cancer until proven otherwise. Question 2. Which is the most common histological type of testicular cancer? A. Seminoma. B. Choriocarcinoma. C. Teratoma. D. Yolk sac tumor. Answer: A. Seminoma. Rationale: seminoma is the single most common histologic subtype. Non-seminomatous tumors are less common individually. Strategy: if asked, most common single type, pick seminoma. Question 3. Which congenital condition most strongly increases risk of testicular cancer? A. Hypospadias. B. Cryptorchidism. C. Hydrocele. D. Varicocele. Answer: B. Cryptorchidism. Rationale: undescended testes increase risk 20-40x, especially if intra-abdominal. Strategy: always link cryptorchidism testicular cancer risk. Question 4. Which blood marker is elevated in non-seminomatous testicular cancers but never in pure seminomas? A. AFP. B. LDH. C. PSA. D. CA125. Answer: A. AFP. Rationale: AFP is secreted by yolk sac and embryonal carcinoma. Seminomas do not produce AFP. Strategy: AFP equals non-seminoma only. Question 5. Which marker may be elevated in both seminomas and non-seminomas? A. HCG. B. AFP. C. PSA. D. SEA. Answer: A. HCG. Rationale: HCG is sometimes elevated in seminomas, syncytiotrophoblastic elements, and also in non-seminomatous tumors. Strategy: AFP exclusive to non-seminomas, HCG both possible. Question 6. Which is the first-line diagnostic tool for a suspected testicular tumor? A. MRI. B. Testicular biopsy. C. Ultrasonography. D. PET scan. Answer: C. Ultrasonography. Rationale: ultrasound distinguishes solid from cystic lesions. Biopsy is contraindicated due to seeding risk. Strategy: ultrasound first, never biopsy testis. Question 7. Which surgical procedure is standard for testicular cancer diagnosis and treatment? A. Testicular biopsy. B. Radical orchiectomy via inguinal approach. C. Needle aspiration. D. Scrotal excision. Answer: B. Radical orchiectomy via inguinal approach. Rationale: radical orchiectomy removes the tumor and prevents lymphatic spread. Biopsy is avoided. Strategy: suspicious mass orchiectomy, not biopsy. Question 8. Which spread pattern is most typical for testicular cancer? A. Hematogenous lung first. B. Lymphatic paraortic nodes. C. Direct invasion into bladder. D. Brain metastasis first. Answer: B. Lymphatic paraortic nodes. Rationale: initial spread is to retroperitoneal paraortic nodes via gonadal lymphatics. Strategy: memorize, testis drains to paraortic nodes. Question 9. A 25-year-old man presents with a painless testicular lump. The first best action is: A. Start chemotherapy immediately. B. Order scrotal ultrasound. C. Needle biopsy of lump. D. Prescribe antibiotics. Answer: B. Order scrotal ultrasound. Rationale: ultrasound confirms a solid lesion, biopsy risks tumor seeding, and antibiotics delay diagnosis. Strategy: always confirm with ultrasound first. Question 10. Which statement about fertility after unilateral orchiectomy is true? A. Fertility is always lost. B. Fertility is preserved because the other testis functions. C. Patient becomes sterile unless sperm banking is done first. D. Testosterone production always stops. Answer: B. Fertility is preserved. Rationale: the contralateral testis usually maintains both fertility and testosterone production. Strategy: reassure, orchiectomy is not equal to sterility. Question 11. Urethral cancer is more common in which sex? A. Men. B. Women. C. Equally common. D. Children. Answer: B. Women. Rationale: unlike most GU cancers, urethral carcinoma predominates in women. Strategy: exception, urethral cancer female-male. Question 12. Which infection is implicated in some urethral cancers? A. HSV. B. HPV. C. Chlamydia. D. HIV. Answer: B. HPV. Rationale: high-risk HPV types have been implicated in urethral squamous cancers. Strategy: think HPV for infection-linked GU tumors. Question 13. Which is usually the first symptom of urethral cancer in women? A. Hematuria. B. Painful urination. C. Hematospermia. D. Flank pain. Answer: A. Hematuria. Rationale: blood in urine, micro or gross, is the earliest presenting symptom. Strategy: hematuria is the universal red flag. Question 14. Which investigation is essential to confirm urethral cancer diagnosis? A. Ultrasound. B. Biopsy via cystourethropy. C. PSA test. D. MRI pelvis. Answer: B. Biopsy via cystourethropy. Rationale: only histology from biopsy confirms cancer, imaging is supportive but not diagnostic. Strategy: image suggests, biopsy proves. Question 15. Which treatment is most often required for extensive urethral cancer? A. Chemotherapy alone. B. Radiation therapy only. C. Surgical excision, often bladder 2. D. Hormone therapy. Answer: C. Surgical excision. Rationale: radical surgical resection is necessary for advanced urethral cancer, often requiring bladder removal too. Strategy: extensive urethral cancer surgery. Question 16. Which is the most common genitourinary cancer worldwide? A. Penile cancer. B. Prostate cancer. C. Kidney cancer. D. Testicular cancer. Answer: B. Prostate cancer. Rationale: prostate cancer is the leading GU malignancy by incidence worldwide. Strategy: prostate equals number 1 GU cancer. Question 17. Which is the least common genitourinary cancer? A. Bladder. B. Kidney. C. Penile. D. Prostate. Answer: C. Penile. Rationale: penile cancer is rare, especially in circumcised men, making it the least common among GU cancers. Strategy: remember, penile cancer is the rare exception. Question 18. Which environmental factor is common to bladder, kidney, and ureter cancers? A. Smoking. B. Alcohol. C. High-fat diet. D. UV exposure. Answer: A. Smoking. Rationale: carcinogens from smoking concentrate in urine, affecting urothelium and kidneys. Strategy: smoking equals universal GU risk factor, except prostate/testis. Question 19. Which factor best predicts prognosis across all GU cancers? A. Age. B. Tumor stage and grade. C. Gender. D. Family history. Answer, B. Tumor stage and grade. Rationale, extent of spread, stage, and differentiation, grade, are the most reliable predictors of survival. Strategy, if the STEM asks prognosis, choose stage plus grade. Question 20. Which GU cancer is often called a silent killer due to late presentation? A. Kidney cancer. B. Prostate cancer. C. Bladder cancer. D. Urethral cancer. Answer, B. Prostate cancer. Rationale, prostate cancer frequently remains asymptomatic until advanced, hence the term silent. Strategy, prostate equals silent, bladder equals bleeding early. Question 21. Which hereditary syndrome is linked with renal cell carcinoma? A. Von Hippel-Lindau, VHL. B. Li-Fraumeni. C. Lynch syndrome. D. Klinefelter's. Answer, A. Von Hippel-Lindau. Rationale, VHL predisposes to clear cell RCC and other tumors like pheochromocytoma and hemangioblastoma. Strategy, VHL RCC association is exam favorite. Question 22. Which GU cancer is most curable even with metastasis? A. Prostate. B. Testicular. C. Bladder. D. Penile. Answer, B. Testicular. Rationale, testicular germ cell tumors are highly chemosensitive, curable even in advanced stages. Strategy, testis equals exceptional prognosis. Question 23. Which GU tumor is best detected with PSA screening? A. Prostate cancer. B. Testicular cancer. C. Bladder cancer. D. Kidney cancer. Answer, A. Prostate cancer. Rationale, PSA is prostate-specific and used for screening/monitoring. Strategy, PSA always prostate. Question 24. Which GU cancer is most strongly associated with schistosomiasis? A. Renal pelvis carcinoma. B. Bladder squamous carcinoma. C. Prostate adenocarcinoma. D. Testicular seminoma. Answer, B. Bladder squamous carcinoma. Rationale, chronic infection with schistosoma hematobium squamous metaplasia carcinoma. Strategy, schistosomiasis equals squamous bladder cancer. Question 25. Which lifestyle modification lowers risk for both prostate and bladder cancers? A. Stop smoking. B. Avoid dairy. C. Reduce caffeine. D. Low salt diet. Answer, A. Stop smoking. Rationale, smoking is the strongest modifiable risk for bladder cancer and also linked with aggressive prostate disease. Strategy, smoking cessation equals best prevention. Question 26. Which GU cancer has the best prognosis overall? A. Testicular cancer. B. Bladder cancer. C. Prostate cancer. D. Renal pelvis carcinoma. Answer, A. Testicular cancer. Rationale, cure rates exceed 90% due to chemotherapy responsiveness. Strategy, testis equals most curable GU cancer. Question 27. Which GU cancer requires lifelong cystoscopic surveillance after treatment? A. Testicular. B. Renal pelvis carcinoma. C. Prostate. D. Penile. Answer, B. Renal pelvis carcinoma. Rationale, upper tract urothelial cancers predisposed to bladder tumors later. Strategy, renal pelvis equals monitor bladder for life. Question 28. Which symptom is most common across all GU malignancies? A. Hematuria. B. Fever. C. Weight gain. D. Polyuria. Answer, A. Hematuria. Rationale, blood in urine, gross or microscopic, is the hallmark of urinary tract cancers. Strategy, hematuria equals red flag. Question 29. Which imaging is best for staging renal cell carcinoma? A. CT/MRI. B. Ultrasound. C. PET. D. For urography. Answer, A. CT/MRI. Rationale, Cross-sectional imaging shows tumor extent and staging details. Strategy, RCC staging CT/MRI. Question 30. Which GU cancer is most sensitive to platinum-based chemotherapy? A. Prostate. B. Testicular. C. Penile. D. Bladder. Answer, B. Testicular. Rationale, germ cell tumors respond dramatically to cisplatin-based regimens. Strategy, platinum equals testis. Question 31. Which GU cancer requires orchiectomy as first-line treatment? A. Testicular. B. Prostate. C. Penile. D. Bladder. Answer, A. Testicular. Rationale, radical orchiectomy via inguinal approach is both diagnostic and therapeutic. Strategy, mass and testis remove, don't biopsy. Question 32. Which GU cancer is most strongly linked with chronic catheter use? A. Bladder squamous carcinoma. B. Prostate adenocarcinoma. C. Kidney carcinoma. D. Urethral carcinoma. Answer, A. Bladder squamous carcinoma. Rationale, chronic irritation squamous metaplasia carcinoma. Strategy, catheter equals bladder squamous. Question 33. Which GU cancer most often metastasizes to the lungs? A. Renal cell carcinoma. B. Testicular cancer. C. Penile carcinoma. D. Urethral carcinoma. Answer, A. Renal cell carcinoma. Rationale, RCC spreads hematogenously. Lungs are the most common site. Strategy, kidney lungs. Question 34. Which cancer can cause polycythemia due to erythropoietin secretion? A. Kidney cancer. B. Prostate cancer. C. Bladder cancer. D. Testicular cancer. Answer, A. Kidney cancer. Rationale, RCC can secrete erythropoietin high hematocrit. Strategy, polycythemia plus renal mass equals RCC. Question 35. Which GU cancer is best prevented by HPV vaccination in boys? A. Penile cancer. B. Prostate cancer. C. Kidney cancer. D. Testicular cancer. Answer, A. Penile cancer. Rationale, high-risk HPV is a major cause of penile carcinoma. Strategy, HPV vaccine protects against penile cancer. Question 36. Which GU cancer is most often associated with anemia from chronic bleeding? A. Kidney cancer. B. Prostate cancer. C. Bladder cancer. D. Testicular cancer. Answer, A. Kidney cancer. Rationale, RCC often causes chronic hematuria iron deficiency anemia. Strategy, RCC equals anemia of chronic blood loss. Question 37. Which GU cancer may cause hypercalcemia due to paraneoplastic secretion? A. Kidney cancer. B. Prostate cancer. C. Bladder cancer. D. Penile cancer. Answer, A. Kidney cancer. Rationale, RCC can produce PTHrP hypercalcemia. Strategy, hypercalcemia plus renal mass RCC. Question 38. Which GU cancer most often causes painful bone metastases? A. Prostate cancer. B. Kidney cancer. C. Penile cancer. D. Urethral cancer. Answer, A. Prostate cancer. Rationale, prostate spreads to bone, producing painful sclerotic lesions. Strategy, bone pain in older man prostate mets. Question 39. Which GU cancer is treated primarily by radical cystectomy when invasive? A. Bladder cancer. B. Kidney cancer. C. Penile cancer. D. Testicular cancer. Answer, A. Bladder cancer. Rationale, muscle-invasive bladder cancer requires cystectomy. Strategy, invasive bladder cystectomy. Question 40. Which GU cancer is linked with cyclophosphamide therapy? A. Bladder cancer. B. Prostate cancer. C. Testicular cancer. D. Kidney cancer. Answer: A. Bladder cancer. Rationale: cyclophosphamide metabolite acrolein damages bladder mucosa cancer risk. Strategy: cyclophosphamide equals bladder toxicity. Question 41. Which GU cancer is linked with von Hippel-Lindau syndrome? A. Kidney, RCC. B. Testicular cancer. C. Bladder cancer. D. Penile cancer. Answer: A. Kidney, RCC. Rationale: VHL mutation predisposes to clear cell RCC. Strategy: VHL equals RCC plus hemangioblastomas. Question 42. Which GU cancer has the highest mortality despite high incidence? A. Prostate cancer. B. Bladder cancer. C. Kidney cancer. D. Testicular cancer. Answer: C. Kidney cancer. Rationale: RCC carries high case fatality compared to prostate/bladder. Strategy: RCC equals deadliest relative to incidence. Question 43. Which GU cancer may require Indiana pouch urinary diversion? A. Bladder cancer. B. Prostate cancer. C. Penile cancer. D. Kidney cancer. Answer: A. Bladder cancer. Rationale: Indiana pouch is a continent diversion post-cystectomy. Strategy: diversions equals bladder cancer surgery. Question 44. Which GU cancer first spreads to paraortic lymph nodes? A. Testicular cancer. B. Bladder cancer. C. Prostate cancer. D. Urethral cancer. Answer: A. Testicular cancer. Rationale: testis lymphatic strain to paraortic nodes. Strategy: testis paraortic nodes. Question 45. Which GU cancer is commonly found incidentally during imaging for hypertension? A. Kidney cancer. B. Bladder cancer. C. Prostate cancer. D. Penile cancer. Answer: A. Kidney cancer. Rationale: many RCCs are discovered incidentally on abdominal imaging. Strategy: incidental renal mass RCC. Question 46. Which GU cancer has greater than 90% 5-year survival if localized? A. Kidney cancer. B. Bladder cancer. C. Urethral cancer. D. Penile cancer. Answer: A. Kidney cancer. Rationale: localized RCC treated surgically has excellent prognosis. Strategy: localized RCC equals curable. Question 47. Which GU cancer may regress after nephrectomy, spontaneous metastasis shrinkage? A. Kidney cancer. B. Bladder cancer. C. Prostate cancer. D. Testicular cancer. Answer: A. Kidney cancer. Rationale: rare immune-mediated regression of metastasis occurs post-nephrectomy. Strategy: unique RCC phenomenon. Question 48. Which GU cancer is best treated with orchiectomy plus platinum chemo when metastatic? A. Testicular cancer. B. Prostate cancer. C. Penile cancer. D. Bladder cancer. Answer: A. Testicular cancer. Rationale: metastatic germ cell tumors respond dramatically to cisplatin-based chemotherapy. Strategy: metastatic testis equals curable with chemo. Question 49. Which GU cancer can cause obstructive urinary stream due to urethral blockage? A. Urethral cancer. B. Prostate cancer. C. Bladder cancer. D. Kidney cancer. Answer: A. Urethral cancer. Rationale: tumors obstruct the urethra, causing weak/interrupted stream. Strategy: obstructive symptoms consider urethral tumor. Question 50. Which GU cancers are most strongly associated with smoking? A. Kidney, bladder, ureter. B. Prostate, testicular, penile. C. Urethral only. D. Adrenal only. Answer: A. Kidney, bladder, ureter. Rationale: tobacco carcinogens affect renal parenchyma and urothelium. Strategy: smoking equals RCC plus urothelial cancers. Great job making it to the end of this session. By practicing these tough MCQs with rationales and strategies, you've built the confidence to tackle even the hardest exam questions on genitourinary cancers. If you found this video helpful, don't forget to like, subscribe, and share it with your classmates. And hit that notification bell so you never miss our next set of high-yield questions. Thanks for watching, keep practicing, and I'll see you in the next video. Good luck with your exams.